Hi, I'm Graham. I needed to build our massages because I couldn't find anything I was happy to recommend patients, but let me share with you why I needed something to recommend in the first place. I had patients who needed more soft tissue therapy than I could provide or that they could get elsewhere, and because of that they'd never get better. Now the issue was most musculoskeletal conditions involve myofascial changes such as myofascial trigger points. Now instead of being like normal muscle, it feels lumpy and ropey. Now these changes alter your posture and cause biomechanical changes, then eventually cause pain. Now one or two applications of therapy may relieve the pain, but to return to normal these tissues need regular therapy over time. Now the research is 100% behind this. Now my favourite example is this chart. Now some of the best musculoskeletal scientists in the world basically hit trigger points with everything but the kitchen sink for 12 weeks. Now the patients felt a lot better, but as the chart shows, most of the trigger points were still there. Now if that didn't do it, the courses of therapy most patients get certainly won't. Now, actually one of my pet hates is clinical trials on things like needles and lasers. Now the people who do these trials will be well aware that there's no way known that the tissues will be back to normal. So what they do is just measure symptoms and ignore the long-term changes. Now that way they can write their therapy up as a success and evidence-based, where the reality is that it's just a very expensive aspirin. So that's the problem. Now after courses of therapy patients feel better, but the problem isn't even close to being fixed. Now their posture and biomechanics are still affected and they'll eventually relapse. Now they may come back for some more pain relief, but they'll eventually give up on you and find someone else. Now with that, let's look at how we use our massages. Now to help reverse those long-term changes, a patient may benefit from several applications of massage type therapy a week over long periods of time. But they don't need to see someone like me that often. Now if I sent them to a massage therapist for the other times, that still needs appointments and payments, so they're not going to get all those applications. Now the patient relapses and it's me that didn't fix the problem. Now what I do instead in clinic is I focus on the things that need my skill and knowledge and get the patients to do supplementary massage at home with our massages. Now I show them where, when and how often and monitor their progress. Now it works really well and I get to focus on things that really need my skills rather than a heap of soft tissue. Now the patients got all the care they needed and got better. Now it made absolutely huge differences to the results I was getting. Now once the massages became available though, it made a lot of other uses possible. Now I've got a video I'll link above discussing how regular massages improve sleep, mental state and even lower blood pressure. Now with these and the proper advice, that's possible. Now there's also sports and exercise related uses such as warm-ups and recovery. Now people are trying to do these with things like foam rollers and massage guns that are far less effective. Now with the proper advice, these will do an awesome job. Now there's even very good research showing that if you use a massager regularly to help normalise circulation, it can make good long-term changes with cellulite. Now I'll link above to that. Anyway, if you're a professional and haven't tried a proper vibration massager like these before, give me a yell and maybe I'll organise you a sample. Now if you're using our machines and not recommending supplementary massage, I recommend you give it a trial. Now you'll get results you can't get any other way. Now a lot of clinics get cartons of massages so they can on-sell to patients. Now if this interests you, just give me a yell. Anyway, thank you very much for watching. It has been most appreciated.